One. My name is Tiffany Tatum, and I'm about to do a video of a head and neck assessment along with the nose, throat, and mouth. I am in the Winston-Salem State's RN to BSN program, and this is the spring semester 2014. Ms. Foster. My name is Tiffany, and I'm going to be your nurse today. Can you tell me what brings you in to see the physician?
Yes, I want to get a physical.
Okay. I'm going to start by examining your head, your nose, your mouth, and your throat, okay? And then when I'm done, I will let the physician know, okay?
All right.
All right. Do you have any unusual headaches at all?
No.
Have you had any recent injuries to your head?
No.
Any neck or head surgery?
No.
Any dizziness at all when you're standing up?
No.
Or changing positions?
No.
Any jaw or neck pain?
No.
Okay. Do you drink?
Socially.
Okay. And what about smoking? Do you smoke?
I don't smoke.
Okay. Okay, so what I'm going to do now is I'm going to examine your head, and what I'm looking for is just to make sure that your scalp is intact. You don't have any redness at all, no lesions at all, so I'm just going to feel around in here. Does that feel okay?
Yep.
Doesn't hurt at all when
Nope.
I'm doing this?
Nope.
Okay, good. Your head appears to be normal for your age and for your ethnicity. Okay. Now I'm going to feel down your face here, and I'm just feeling your temporal mandibular joint. So what I want you to do while I'm rubbing right here is just open and close your mouth for me. Do you feel any discomfort at all when you're doing that? One more time for me. Good. No pain there. Okay. Now I'm just assessing your face here to make sure that your eyebrows and your eyes are lined up appropriately with your ears, and that there's no facial drooping noted, and I don't see any. That all appears normal. Your head is midline to your body. It doesn't feel heavy at all. You're able to hold it up. Is that correct?
Yes.
Good. Okay, now I'm going to give you some simple commands that I want to see if you can follow for me. And I just want to make sure you don't have any strain at all, any pressure at all when you're doing these. First, I would like for you to take your chin to your chest. Any difficulties in there? Any pain at all when you do that?
No.
Okay. I want you to touch your ear to your shoulder. Try not to move this shoulder. Okay. Can you do the other side for me? Any pain or discomfort at all there?
No.
Good. Okay. Now I want you to nod yes or no in a slow motion, back and forth. Good. And no pain at all noted? None on your chest at all when you put your chin down?
No.
Okay. Now I'm going to move along, and I'm going to examine your cranial nerve 11, which is your spinal accessory nerve. What I'm going to do is place my hands on your shoulders, and I want you to shrug your shoulders and look to the left. Okay. Now shrug and look to the right. Okay. And I don't notice any pulsations there at all. And I don't see any enlargement in your salivary or your lymph gland, so that's good. Now I'm going to take a look at your lymph nodes. Have you noticed any swelling at all in your neck, throat area?
No.
Okay. I'm just using a circular motion here to feel or palpate your lymph glands. And I'm not able to feel any, so that's good. There's no swollen. Swollen lymph nodes indicate a sign of infection. You look good there. Okay. Now I'm going to feel for your trachea. It does appear to be midline to your body, so that's good. Now, Ms. Foster, I'm going to step around behind you, and I'm going to feel for your thyroid gland, okay? I'm going to give you some simple instructions when I step around, okay? Alrighty. First, I'm going to find your trachea and make sure it's midline. I'm going to shift it over to the right, and now, Ms. Foster, I want you to look over to the right. Look over to the right for me. Good. Now look straight. Now I'm going to shift your trachea to the left, and I want you to look over to the left. Good. I was not able to palpate your thyroid gland, so that's good. That indicates there's no enlargement, okay? Alrighty, so next we're going to move along to your nose, your mouth, and your throat, okay? Have you had any frequent colds or any runny nose, nosebleeds at all, or any type of allergies?
No.
Good. Okay, I'm just going to run my finger down your nose here, and I'm just making sure that your nose is aligned correctly on your face and that there's no pain when I palpate on your nose. Okay, I'm going to get you to close one side and take a deep breath in, okay? And let it out. Good, we're going to do it again. Great. And that's just to make sure there's no obstruction. You don't have any inflammation going on in your nose. Okay, now I'm going to take a look up your nostrils here, okay? What I'm doing here is just making sure that your nares are pink on the inside and that they're moist. That indicates normal findings, okay? Good. And great. Everything appears moist and pink. I don't see any signs of infection going on right now or inflammation. Now I'm going to feel at your sinuses. If you feel any pressure here or pain when I'm pushing, you just let me know. How does that feel?
Fine.
And what about when I do it down here?
Fine.
Good. That is good. Okay. Do you have any sores at all in your mouth?
No.
Any lesions at all in your, any bleeding gums that you notice at all?
No.
Okay. Alrighty, Miss Foster. What I'm going to do now is I'm going to pull your lips down. I'm going to take a peek, and I'm just checking to make sure that they are appropriate in color and that I don't see any open sores at all in your mouth. And that looks good and appropriate for your age. And that also looks good and appropriate for your age. Your gums are pink and there's no swelling noted at the gum line. Okay, next I'm going to have you stick your tongue out for me. Good, and now touch your tongue to the top of your mouth. Okay, now I'm going to use this gauze, Miss Foster, and I'm going to pull your tongue out. And what I'm looking for is to make sure there are no lesions or anything that's indicative of any type of oral cancers, okay? So I'm just going to pull. That looks good. And that looks good. Everything appears to be pink and moist. Alrighty. I'm going to feel down here in your mouth, and I'm just feeling for any type of ulcer. Does that hurt?
Mm-hmm.
Oh, it just startled you.
Mm-hmm.
Okay, any type of ulcerations or anything, and that doesn't. It feels fine. There's no nodules or ulcerations noted. Okay, now I'm going to use my wooden spoon here, and I'm just going to take a peek at your cheeks and then in the back of your throat, and we'll be almost finished. So I'm just looking in here, and I'm just making sure your inside of your jaws are pink and moist, and they are. Now I'm going to grab my flashlight here, and what I want you to do, Miss Foster, is lick your tongue out and say ah, and I'm just checking your uvula in the back of your throat.
Ah.
Okay, I do see that. Can you lick your tongue out, ma'am? Okay, I do see that is midline and where it's supposed to be. I don't see any tonsils. Did you have your tonsils out as a child?
Uh-huh. Yep.
Okay. Well, thank you very much, Ms. Foster. That concludes my exam, and I will let the physician know that you're ready for him, okay?
All right.
Thank you.